tend to us, they can move a greater proportion of their blood without having any problem. I know I personally, our little cockatiel had a foot injury, and there was just blood everywhere, and he recovered well from it. He didn't need a transfusion or anything like that. So to give you a bit of an idea, a cockatiel could safely lose about 1 ml of blood, whereas something like a macaw could quite safely lose about 9 to 11 ml of blood. Obviously, we don't want our birds losing blood, so I wouldn't suggest just leaving them out or anything like that. But just to put it in perspective, the other thing is when you see blood, it always looks like more than there is. So if you get 10 ml of water and flip it on the ground and see how many droplets there are, it looks like quite a bit of water, but in comparison, it's actually not that much. So that's just something to be aware of. Stay calm and assess the situation rather than freaking out about the amount of blood that's lost. The most important thing on bleeding skin is to very gently with a damp gauze wipe the area so you can actually see where it's coming from. Because all the feathers get in your way, it can make it difficult to find out exactly where the bleed's coming from. Once you've found the area, very gently put some pressure on it. Try and hold it off for as long as you can. So 2 minutes is great. In a moving around birds, as long as possible. The other thing with birds is they clot a bit differently to people where their clotting is actually stimulated by inflammation. So giving it a gentle rub while you clot it, or while you hold pressure, can actually aid in sending the cells there that they need to clot. So that's something else that can help. And even after you give birds injections, when you're doing that at home, giving it a gentle rub afterwards while putting pressure on will help clot everything off. Obviously, if it continues to bleed after you've tried holding it off, or it bleeds again soon after, it could be a sign your bird has a clotting problem, which can be very common in birds with liver disease, especially if they've been on steam diets and have a bit of fatty liver, because the liver produces the clotting factor. So that's just something to be aware of. If it seems to be bleeding and bleeding and bleeding, better to get a look at and try and get it stopped. In terms of the bleeding nail, I know this happens when you're at home, and it can be a bit scary because they do bleed quite a lot. So if you are trimming your bird's nails, they can cut it quick and they'll bleed. So the most important thing is restrain your bird well, or have somebody else hold the bird so you can hold the foot and examine it. Just gently tap the end so you can see where it's bleeding from. You can actually use an emery board or a nail file, give it a quick swipe, and that can just help aid in the clotting as well. And it also gets the nail nice and smooth so you're not having hangnails that can bend a lot. Pinch the toe above where it's bleeding, like on the toenail itself. Pinch firmly but gently, obviously, for about 2 minutes. That can be enough to stem the flow of blood and get clotting going. If not, something else you can do is either cornstarch, so cornstarch helps with clotting, or if you just have a bar of soap at home, get the nail, rub it through the bar of soap, hold it for a couple of minutes, and sometimes the soap can just pop that end off for you and stop the bleed. So that's something else you can do. Once again, the bleeding really should stop within 2 minutes, especially if you put pressure on it. So if it keeps going, it's probably a sign that there's something wrong and you need to look at whether your bird is clotting normally. At the vet, we can actually do what we call nail quartering, where we burn the tip of the nail. So that's something we can do if it's nothing keeps bleeding. So a bleeding feather follicle is something else we see quite commonly, because when birds are producing their feathers, the new feather has an artery going down the middle of it, which supplies blood to the feather to give it nutrients and everything while it grows. So it's part of the normal growth phase of the feather, and when they're cut off or pulled out early or broken, they will bleed a lot. So that's something else we do see quite commonly. And often the birds are holding up their wings with quite stress, which is a bit painful as well, because there are nerves in that area. So once again, restraining the bird and gently extending the wing. If necessary, have someone restrain the bird so you can hold the wing properly, because especially in little birds, if they're flapping around a lot and you don't have good control of that wing, they can fracture or injure themselves. So the hardest part is probably locating which follicle is bleeding. So again, cleaning the area gently so you can actually see where the blood is coming from is important. Once you've found that, sometimes putting pressure on that feather and pinching it can be enough to clot it, so you don't have to actually pull it out. Otherwise, if it continues, you do have to look at removing the feather itself. Now that's something ideally takes to a vet to get done, because when you pull the feather out, you can cause, especially in a little budgie or something small, you can break their wing if they're not restrained properly and not putting good enough pressure on. But the most important part is you need to grasp the feather firmly with a pair of tweezers or something similar. You need to hold just above the follicle of that feather so that you're supporting the wing and the follicle while you pull it out. There's other direction it's growing out. So pulling it in the same direction. Once you've got the feather out, putting pressure on that area again for 2 minutes will clot that little area of skin that you just pulled the feather out of. So like I said, it's something that ideally you should get your vet to do, and especially if the bird's really, really distressed, we can even just do a quick anaesthetic to get it out, because some birds, especially some of the little birds, can stress to the point of really hurting themselves because they get quite worked up with their high heart rate. Okay, so strapping wings. Once again, this is something obviously ideally the vet would do, but if you have a bird and you want to do something temporary, we do what we call a figure 8 pattern. So basically, your bird's wing is tucking up against it like this, and you're doing a pattern around there. So to show you on this little bird, they wrap it around here and around here. So you're going in that little figure 8 pattern. This to hold the wing kind of closed and against the body. Once you've got it around the wing itself, you then wrap it around the other side of the bird, under the opposite wing, and then around again. So you're holding that wing close to the body. So that's something temporary you can do. The most important thing is ensure your bandage doesn't restrict breathing. Because you are going around the chest, and birds don't have a diaphragm to pull their lungs down, so they only breathe with their actual chest wall. So if you constrict that, they can't breathe. The other thing is, don't use any sticky bandages, because obviously no one wants bird at the end of it. And also usually the less sticky the bandage, it has a bit more fluid as well, so that's something else to make sure they can breathe. So in terms of legs, again, strapping legs is something ideally done by a veterinarian, but it is something you can do at home. With foot injuries, especially toe injuries, they are really, really nasty. So it's something you can attempt, but I'm not even going to attempt to describe how to do it because you have to do all kinds of funny things. It depends on where the injury is, but it is something you can attempt. You just have to get a bit creative. In terms of the leg itself, a little bit easier, a little bit straighter and less little things poking off it. But the most important thing is, particularly if you feel that the bird could have a fracture or break, is to strap one joint above and one joint below where the injury is. Because if you don't stabilise both joints, that area will keep moving. So that's the most important thing. So usually we like to place a soft layer first to protect the leg. You can then put a splint in if necessary in a little bird just to keep the cartilage will be enough because they don't need a lot of support. The second layer, we have stuff called vet wrap, which is kind of like a stretchy material that sticks to itself but doesn't stick to other things. So that can be really useful when you're bandaging birds because you can get it to stick down but not on the bird itself. Something else you can do to help is, there's a picture of it down here. Basically, they just extended the bird's leg, particularly on a small bird. Probably isn't going to work as well on one of the larger birds. And essentially with a kind of a thick tape, you just stick one side, stick down on the other against the leg like that, and then just trim it. And that can be enough to just keep the leg stable until you're able to get into a vet, get a proper bandage or x-rays and things done to find out what's going on. Using bandages can also be a good way to help with bleeding as well. So if there's a cut on a leg in an area that you feel you can bandage, that can just help apply pressure for a period of time and then remove it and see if the bleeding stops. So one of the most important things is